Hello, folks. My name is Dr. Michael Jones. I'm president of PostRehab.com and the Medical Exercise Training Institute in Houston, Texas. I'd like to take a few moments to talk about medical exercise services client categories. Over the last 20 years, we provided a wide range of medical exercise training certifications, workshops, and overall educational programs to fitness professionals that want to bridge the gap between healthcare and fitness. Over the last 20 years, we've seen a migration away from post-rehabilitation fitness to now more medical exercise services. With that change in the atmosphere, and I should also say the evolution, we're now starting to look at client categories. So I'd like to take a few moments to talk about these different client categories we're encountering in medical exercise services. As we go through these client categories, we're going to look at a number of different components. We'll look at the client's functional status. This indicates their capability based on the 11 functional components that we've identified in our medical exercise training series. We'll also look at the client's medical status. This indicates the client's ability to tolerate exercise based on the intensity of their red flags, the time of their surgery, injury, or the onset of their condition. We'll also look at their referral status, which indicates the source of the client's participation in a medical exercise services program. We'll look at obviously various client conditions, and then lastly, how to monetize medical exercise training services by looking at what types of services are used to generate revenue for the clients that are coming in. All clients that are coming in for medical exercise services have some type of residual functional deficits, and each client requires that the medical exercise professional appropriately screen the client to identify red flags and to make sure the client is appropriate for medical exercise services. And if they're not, that client is then referred back to their doctor, therapist, or chiropractor for further medical services. Our first client category is the post-rehab client. Now, the post-rehab client is actually where our organization started some 20 years ago. When we started out in the early 1990s, the idea was that our physical therapy patients, when we discharged them from our clinics, would be immediately referred on to a fitness facility where there'd be a medical exercise professional or post-rehab professional to provide direct services, and those services were developed based on direct referrals from our physical therapy clinics. Well, we've seen that evolve over the years, but we like to start with that client category. The post-rehab client has residual functional deficits after their surgery, the injury, or the onset of their condition. Or they still have residual functional deficits that are left over after physical therapy. Now, the important point to note here is this client is under 1 year post-rehab. And what we mean by that is they are 365 days or less from the surgical procedure, the injury, or the onset of their condition. And as we know, that first year of rehabilitation is most important in hopefully restoring the client back to their previous level of function. So the key thing here to understand with the post-rehab client, they are 1 year or less removed from their surgery, the injury, or the onset of their condition. These clients are normally referred by a doctor, therapist, or chiropractor, and because they are 1 year or less from the onset of their condition, the surgery, and or the injury, a referral is required from a medical professional. These clients normally are medically stable, screening is required, and they should not have any red flags. These red flags are looked at when the client comes in for their initial screening and assessment. If red flags are identified, the client is then referred back to their physician, or the medical exercise professional communicates with their doctor, therapist, or chiropractor to make sure the client is appropriate for exercise. The key component here is that the client is medically stable to begin an exercise program. They should be able to tolerate it. Some of the common conditions we'll see here will be an ACL rupture, maybe a reconstruction, a laminectomy, a rotator cuff tear, total joint replacements, as well as clients with hypertension, diabetes, things of that nature. So when we look at the monetization process, we find that our protocol-based MedFit training programs or small group training programs are very appropriate for these clients. They're less than 1 year from the onset of their condition, the injury, and or the surgery. So entering them into small group training programs that provide both education and exercise is very appropriate for these clients. So these small group programs, or MedFit training programs, would include our dynamic back school, total joint replacement training programs, our women's fitness 101, or our hypertension, diabetes, and obesity group training programs. These clients also benefit from one-on-one training for those clients that need more specific one-on-one medical exercise services. And at the completion of either their one-on-one training or the completion of the MedFit group trainings, these clients now become eligible to purchase or be involved in our medical memberships. So this basically summarizes the post-rehab client. These are going to be clients, again, that are coming directly from referrals for the client from physical therapy, chiropractic, or medical care. And again, they are 1 year or less removed from their injury, the surgery, or the onset of their condition. Our next client category is the medical exercise client. Now, we've seen a tremendous increase in this client category over the last 20 years. When we started our program, our medical exercise specialist workshop back in 1994, the primary client category was that of the post-rehab client. But we've seen over the last 20 years, as more and more individuals are starting to realize the benefits of exercise and now starting to migrate into medical exercise training facilities on their own, we're seeing a growth in the medical exercise client category. Now, these clients have chronic conditions. They also have functional limitations of what we call residual functional deficits after physical therapy, chiropractic, or medical care. But these clients differ from the post-rehab client in that they are greater than 1 year removed from the onset of their condition, the injury, and or the surgery. And as we said before, that first year is most important in properly medically managing their condition. So these clients are greater than 1 year. So they're 366 days and or more. These clients are usually not referred. They actually join on their own because at this point they've probably gone beyond the limits of medical care. They're probably managing their condition with periodic visits to their physician, physical therapist, and or chiropractor. And because they're greater than 1 year, they're now probably managing their condition on their own, as I said, with periodic visits back to their physician. These clients, again, are medically stable. A screening is required for every client coming into medical exercise services. So even though they're greater than 1 year, they're a medical exercise client categorized, they still need to undergo a screening. If any red flags are identified at the time of the screening, then medical consultation is necessary for the client to obtain a referral. The conditions we commonly see in this category include hypertension, diabetes, CVAs, spinal fusions, total joint replacements, osteoarthritis. A wide range of clients fall into this category. And these are individuals who've received medical care, physical therapy care, chiropractic care, but now after the insurance coverage has run out, they run the gamut of those services. At this point now, they're looking for an exercise program to help them maintain their level of function or improve their level of function. And again, these clients will benefit from our MedFit group training programs, such as our Dynamic Back School, as I mentioned earlier, our Total Joint Replacement program, Women's Fitness 101, and our Hypertension and Diabetes program. These clients also are candidates for one-on-one medical exercise training services, as well as when these clients complete either one-on-one training or they've completed one of the MedFit group trainings, they now become eligible for a medical membership to help them continue on maintaining their functional status, but without the direct supervision that they'll find with one-on-one training or our MedFit group training programs. This client category is going to continue to increase over the next decade. Our next client category is that of the corrective exercise client. Now, since we started our program in 1994, we've seen a significant growth in the number of corrective exercise specialists and professionals in the fitness realm. This client category is one that we need to be very careful about because with these clients, sometimes when we look at the idea of corrective exercise, we immediately think that the client's problems are totally postural, muscular in nature, and those can be easily managed with exercise programs. If the client truly does have a purely postural muscular problem or muscular imbalance, those definitely can be managed with exercise. But in many instances, postural or what appear to be postural muscular imbalances actually are simply means of masking organic issues or organ system dysfunctions, neurologic issues, and or joint dysfunctions that are beyond just simply postural muscular in nature. So with this client category, these clients have a postural imbalance that has been identified. There is no acute injury or recent surgery or medical condition associated with the corrective exercise client. If during the client's screening, which of course includes a medical history, if it is identified there's an acute injury, a recent surgery, or a medical condition associated with this postural or muscular imbalance, then the client now moves into a different category. And at this point, we do need to communicate with their doctor, therapist, or chiropractor to make sure that appropriate medical exercise services are rendered, but also to make sure the client isn't in need of medical intervention. Again, these clients are usually not referred. They usually come into the facility on their own. And if we're starting a corrective exercise program with the client, if we do not see some improvement, doesn't have to be marked improvement, but some improvement after 3 or 4 sessions, then we need to reassess the client. Again, go back through the medical history, the screening, as well as the assessment process to make sure nothing has been missed. And if we do find red flags, then at that point, the client needs to be referred on for further medical examination. Again, with these clients, a screening is required. We assess for red flags on regular intervals, and if these clients' pain levels are 5 or greater, then they should be referred on to a medical professional. What we should see is the client's pain level are 5 or less, which means they can benefit from an exercise program. Some of the common conditions we'll see here will be a wigging scapula that has no neurologic involvement, functional scoliosis, lumbar dysfunctions, or some of the common cross syndromes that Yonda talked about in his works. These clients usually benefit from one-on-one assessment and one-on-one training. There are no MedFit programs for the corrective exercise clients, so no MedFit group training programs. These clients do benefit from medical memberships after they've completed their course of corrective exercise and their muscular imbalances have been corrected, and then the client is given an exercise program they can do on their own. But one of the key things we do see here is not definitely a monetization process, but one that we see as an indirect monetization process is that in many instances when these clients come in and it is identified that they do have some underlying medical problem, joint disorder, or neurologic issue, something beyond just simply a postural muscular imbalance, the ability to refer this client out to a medical professional in the community and then develop reciprocal referral relationships certainly is one that does help monetize the medical exercise professional's practice. That now leads us to our next medical exercise services client category, the functional maintenance client. Now, this client category is one that will exponentially increase over the next 2 decades. With the increase in the number of baby boomers that are now coming into the healthcare system, those individuals having total joint replacements, suffering from chronic conditions such as osteoarthritis, hypertension, diabetes, we're going to see more and more individuals that are coming into this category, which is marked by those individuals that we may not see significant improvement in their level of function, but we find that the medical exercise training programs and medical exercise services are helping the client to maintain their level of function. So for these clients, they've normally completed a course of physical therapy and/or chiropractic care. They have chronic conditions that require exercise to maintain their level of function. Now, this category is important because for these individuals, maintaining their level of function means maintaining their independence, maintaining their dignity, maintaining their ability to be a contributing member of society. We find in some instances with these clients, when they lose their level of functional capability, they now become either bedridden, they become homebound, or they may need to enter into extended care facilities or become clients in extended care facilities. So what we find with this group is 50% of these clients are referred by medical professionals, and another 50% are referred by either loved ones, friends, or they just simply seek out medical exercise services on their own. With these clients, a screening is required, and again, we assess the client to see if they have any red flags by conducting our musculoskeletal screening, performing our normal medical history assessment, and then going through our standard MedFit assessments. Some of the common conditions we'll see here will be osteoarthritis, post-cardiac rehab, hypertension, diabetes, neurologic conditions including stroke, MS, Parkinson's disease. So what we see with these individuals is these are conditions that are going to stay on, obviously long term. We may not see much movement in the client's ability to become disease-free, for lack of a better phrase. But we found with these clients, the exercise program is instrumental in helping them maintain their level of function. So these clients do benefit from some of our MedFit group-based programs, including our Dynamic Back School, our Total Joint training program, and our arthritis program are very big for our functional maintenance clients. Our Women's Fitness 101 is very important for our functional maintenance clients because many of our female clients that are coming in that are in this category have never exercised before. And the exercise program certainly does keep them vital and helps them to maintain their level of functional capabilities. Our hypertension, diabetes, and obesity programs are very effective at managing these clients, as well as medical memberships for clients that have come in through our post-rehab training programs, our medical exercise training programs, or client categories. Many of these clients, when they finish their one-on-one training, they now opt for medical memberships, and that helps them to maintain their level of function. With the medical memberships, these clients also receive a monthly assessment and or reassessment and update to their program, and then that information is forwarded on to their physician. So you can see here with our client categories, this now allows us to categorize all clients that are coming into the facility. It allows us now to look at what medical exercise services need to be rendered. It also allows us to get an idea of where the referral sources are or where the referrals are coming from. It also allows us to now look at the idea of how do we monetize and manage this client effectively so that the services we're providing are effective for the client but also profitable for the facility. Thank you for listening to this presentation, and if you want to get more information on categorizing the medical exercise client and how we can actually better manage those clients, please check out our network at www.medxpronetwork.com. The MedX Pro Network is designed to help you, the medical exercise professional, build a profitable practice, connect with medical professionals, and produce the outcomes for your clients. So thank you again for listening. Best wishes to you in building your medical exercise practice, and please check us out at medxpronetwork.com.